Hey, Dr. Dave Marquis here, and I'm going to go over some exercises and stretches for the upper body and neck right now. One of my favorites, and this one I learned this one back in school like 30 years ago. Anita Roberts, I have to give a shout out to her. She's the one that taught this to me. This has had an amazing payout on neck stability and the ability for the joints of the neck to have a fighting chance to counter the repetitive strain and workload that we put on it from all the computer work that we do. So many of us sit at a desk, and I'm going to turn sideways, because we'll sit at a desk and we end up in this position by the end of the day, where our neck is extended, so our suboccipital muscles are super tight, our shoulders are internally rotated because we've been typing or mousing, our thoracic spine is becoming hyperkyphotic, and we've lost our lordosis here in the lumbar spine. I mean, we truly become knuckle draggers in that position, and many people, I tease patients about this, where they'll start to wear their shoulders for earrings because they've been compensating and just trying to deal with the tensions of the day, and their shoulders are way up here by the ears now. So head's forward, extended, shoulders are high and internally rotated. The exercises that I'm going to show you will help to oppose all of that. And it's super important that you do that because many of the dysfunctions of the cervical spine, some of our proprioception, so think stability, it all comes down to how the neck is functioning. I've seen many cases of vertigo where people are feeling a little dizzy start because of this, because the muscles of the neck are just out of balance. So here's the principle that I want you to think about. I'm going to contract my bicep. It's tight right now. My tricep is flaccid. That's because when I bring this forward, this one shortens. This one is now elongating because I'm bringing it back. This is the mover. Here's the stabilizer. My brain is allowing that to happen. Every muscle in the body has a mover and a stabilizer. Here in the neck, we don't think about it because you don't see them. Nobody says, hey, flex your neck. You're going to look awesome. Well, the muscle that we're talking about in the neck, it's called the longus colli, and it's deep to your trachea. You can't see it. It's attached to all of your cervical vertebra. It's deep inside there. When that muscle gets weak, what happens is all the muscles on the backside of the neck, by default, have to become super tight. And we're doing it to ourselves because we're sitting in that position for prolonged periods of time. When that happens day after day, week after week, month after month, and year after year, people start to develop what's called military spine, and they literally lose the curvature in their cervical spine, and they end up with chronic neck and head pain. 80% of headaches come out of the neck and shoulders. So you got to think, if your head's not feeling great, and you're not in the 20th percentile that are going to be metabolic, you're structural. It's coming out of your neck and shoulders. So, without any further ado, here it is. You basically just lay on your back, and you're going to put your hands underneath your hips so that your shoulders open up. And as my shoulders open up right now, I've got my chin tucking so that I'm starting to contract my longus colli. Now my voice is probably going to sound pretty funny as I do this because I'm going to be totally tucked, but I'm going to curl my head up, and I'm right now feeling a little bit of a tremor because my longus colli needs a little more exercise. And then I'm going to drop back down, and then I'm going to relax. Things that I just did, so success points. Shoulders are as open and as flat as they can be against the floor. My tummy and my chest, I'm trying to keep it soft so I'm not cheating. I'm not engaging those muscles. I'm tucking my chin as deeply as I can before I lift it off of the floor. And once I'm in that position with all those other factors in play, I now lift the head off of the floor. And you don't have to come very high. Right there is perfect for me. And you hold it for 5, 4, 3, 2, 1. Drop it down while tucked, and then relax. The goal is to do 15 of those before you leave your bed in the morning, and 15 before you close your eyes at night. That's the goal. What I find with most patients is that they're weak enough that when I have them first engage this, they'll either shake a lot, or when they lift their head, their chin will lead. They're kind of cheating because they're using the sternocleidomastoid instead of the longus colli. And if you're using the wrong muscle, you're not going to have the payout. So it's really important to include all the steps that I just showed you to do this one successfully. But if you do it daily, literally after about 20 days, you're going to start to notice a significant change in the stability of your cervical spine.